Welcome to the Certified Digital Health Records Compliance Specialist course, presented by CDG Training. This course is designed to help you master digital health records governance, compliance, privacy, security, lifecycle management, and regulatory excellence. This section lays the foundation for understanding digital health records compliance. We'll cover core concepts, governance principles, regulatory frameworks, stakeholder roles, and emerging trends that shape modern healthcare information management. Welcome to the Certified Digital Health Records Compliance Specialist course presented by CDG Training. Digital health records are among the most valuable assets within healthcare organizations. Effective management of health information supports patient care, regulatory compliance, operational efficiency, privacy protection, and security management. Digital health records are electronic versions of patient health information maintained throughout the continuum of care. They support care coordination, information accessibility, and healthcare decision-making. Healthcare documentation has evolved significantly over the past several decades. The transition from paper-based systems to digital platforms has transformed how patient information is captured, stored, and shared. Compliance ensures that health information is managed responsibly and consistently across the organization. A robust compliance program is a critical component of healthcare operations. Information governance establishes the structures, policies, and accountability mechanisms needed to manage healthcare information effectively. Strong governance promotes organizational excellence and ensures that health information serves its intended purpose across the care continuum. Privacy and confidentiality are foundational principles of healthcare information management. Healthcare organizations must ensure that sensitive information is accessed, used, and disclosed appropriately. The regulatory environment for digital health records is complex and requires adherence to various standards and policies. Organizations must understand and comply with these regulations to ensure the protection and integrity of health information. Effective health records management requires collaboration among multiple stakeholders. Shared responsibility supports successful information governance across the organization. Poor health records management may create significant organizational risks. Risk awareness supports proactive compliance management and helps organizations avoid costly consequences. Healthcare information management continues to evolve through emerging technologies and new care delivery models. Organizations must remain adaptable to changing expectations and technological capabilities. This course is structured to build practical competencies progressively, equipping professionals with the knowledge and skills needed for excellence in healthcare information management. Long-term success in health information management depends on more than policies and technology. Organizations must foster a culture that emphasizes shared values and professional responsibility. Welcome to Chapter 1, where we explore the foundations of digital health records management, a crucial aspect of modern healthcare. This chapter covers key areas including health information management principles, digital records, compliance, and patient care. Understanding digital health records management is essential for maintaining accurate, accessible, and secure information. Health information plays a vital role in patient care delivery, clinical decision-making, and regulatory compliance. Core principles like accuracy, accountability, and confidentiality guide effective health information management. High-quality health records are accurate, complete, timely, and relevant, supporting safety and effectiveness. Digital health records include demographic information, medical history, and treatment plans, among others. Healthcare documentation is fundamental to communication, care continuity, and compliance. Information stewardship ensures data quality, security, and compliance throughout its lifecycle. Legal and ethical foundations protect patient rights and ensure professional accountability in health information management. Information integrity is crucial for accurate clinical decision-making and patient safety. Healthcare information must be accessible when needed, balancing security and availability. Information governance ensures effective management and compliance with regulatory requirements. Challenges in digital records management include incomplete documentation and privacy risks. Technology plays a critical role in efficient health information management, enabling data analytics and security. Compliance responsibilities extend across the organization, ensuring quality and security in health information. A case study shows how improving documentation quality can enhance record accuracy and audit findings. Clinical documentation is the largest component of digital health records, followed by diagnostic results and medication records. Key drivers of health information quality include documentation accuracy and staff training. Effective records management involves prioritizing documentation quality and maintaining strong governance. Digital health records management supports patient care, compliance, and information protection across healthcare. Welcome to Chapter 2, where we delve into the world of electronic health records and electronic medical records, essential components of modern healthcare information management. This chapter provides an overview of EHR and EMR concepts, their implementation, interoperability, and compliance best practices. Electronic medical records are digital versions of patient charts, primarily supporting patient care within a single healthcare organization. Electronic health records are comprehensive digital records that support information sharing across multiple healthcare providers, enhancing continuity of care. EMRs and EHRs, though often used interchangeably, have distinct characteristics that define their scope and connectivity. Digital health records offer numerous advantages, including improved accessibility, care coordination, and documentation quality. EHR systems integrate various components to support comprehensive patient care and organizational performance. Clinical documentation is crucial for quality care, legal compliance, and continuity across providers. Clinical decision support systems enhance patient safety by providing real-time guidance to clinicians. Computerized provider order entry allows clinicians to efficiently submit orders, reducing errors and improving workflow. Successful EHR implementation requires careful planning across technical and organizational dimensions. Adoption challenges may arise when transitioning from legacy systems, requiring effective change management strategies. Interoperability enables systems to exchange and use information effectively, supporting healthcare delivery across organizations. Health Information Exchange enables secure sharing of health information among authorized organizations. Healthcare organizations must ensure EHR systems meet regulatory and compliance obligations. Security controls help protect digital health records and safeguard patient information against unauthorized access. A regional healthcare provider's EHR modernization project demonstrates the value of strategic planning and stakeholder engagement. EHR adoption leads to significant improvements in care coordination and information accessibility. EHR implementation projects often face challenges related to user adoption, training, and system integration. Established best practices improve system effectiveness, compliance performance, and clinical outcomes. EHRs and EMRs play a vital role in modern healthcare delivery, supporting clinical care, information accessibility, and operational efficiency. Welcome to Chapter 3 on Healthcare Information Governance, where we explore the frameworks and strategies essential for managing health information effectively. In this chapter, we delve into governance frameworks, accountability models, policy management, and compliance oversight, all crucial for effective healthcare information governance. Information governance encompasses policies, processes, and standards that ensure healthcare information is managed effectively, improving quality and compliance. Effective governance prevents issues like inconsistent documentation, privacy breaches, and data quality issues, ensuring reliable and secure information management. Core objectives of information governance include protecting patient information, ensuring data accuracy, and promoting accountability across the organization. Key components of information governance include policies, leadership oversight, information stewardship, and risk management, all working together for a structured framework. Governance frameworks address accountability, decision-making authority, and compliance requirements, delivering measurable organizational value. Accountability in information governance ensures clear responsibilities for managing healthcare information, enhancing effectiveness across the organization. Information stewards play a critical role in maintaining information integrity, overseeing data quality, classification, compliance, and lifecycle management. Governance involves diverse roles, including executive leadership, HIM professionals, compliance officers, and privacy officers, all collaborating for effective outcomes. Policy development and management provide direction for consistent healthcare information management, supporting regulatory compliance and operational consistency. Standards and procedures ensure consistency and compliance across the organization, translating governance policies into actionable practices. Data quality governance ensures healthcare information meets standards for accuracy, completeness, and consistency, supporting patient care and compliance. Information lifecycle governance addresses creation, storage, collection, and use, ensuring information remains protected and compliant at every stage. Compliance oversight ensures alignment with organizational policies and regulatory requirements, supporting readiness across the organization. Risk management within governance programs identifies and mitigates information-related risks before they escalate, improving decision-making and resilience. Governance committees and oversight bodies establish accountability and provide structured oversight of governance programs, enhancing organizational effectiveness. A case study demonstrates the measurable value of structured governance and clear accountability in healthcare organizations, improving patient care and regulatory compliance. Information governance programs focus on data quality, compliance, privacy, and security, addressing multiple priorities simultaneously for mature governance. Successful governance programs depend on leadership commitment, accountability, strong policies, and workforce education, driving organizational success. In summary, healthcare information governance transforms information management into a strategic asset, ensuring accuracy, protection, and compliance. Welcome to Chapter 4, where we delve into the crucial aspects of privacy, confidentiality, and patient rights in healthcare information management. In this chapter, we will cover the fundamental principles of privacy, confidentiality, and patient rights, essential for maintaining trust and supporting ethical care delivery. Understanding healthcare privacy involves knowing how personal health information is collected, used, and protected. It's about maintaining trust and meeting regulatory obligations. Confidentiality is about protecting information entrusted to healthcare professionals, supporting both ethical and legal responsibilities. Privacy and confidentiality are distinct yet interconnected concepts, forming the foundation of healthcare information protection. Patient trust is vital for effective healthcare relationships, reinforced by honest communication, better care outcomes, and active patient engagement. Patients have rights regarding their health information, and organizations should support these rights consistently and transparently. Patients have the right to access their health records, ensuring transparency and engagement in their care. Patients can request corrections to their health information, ensuring accuracy and better patient outcomes. Consent management is crucial for patient autonomy and organizational transparency, involving authorization, documentation, tracking, and revocation processes. Different types of consent in healthcare include treatment-related, information sharing, research participation, and electronic communication. Healthcare information should only be used or disclosed for authorized purposes, ensuring proper authorization and secure transmission. The minimum necessary principle limits information access to what is required, supporting privacy protection at every level. Ethical considerations in health information management include privacy protection, professional accountability, and patient dignity. Organizations must identify and manage privacy risks, including unauthorized access, lost devices, and social engineering attacks. Privacy governance involves establishing policies, conducting risk assessments, training, and monitoring activities to ensure compliance. Workforce responsibilities for privacy protection include following policies: protecting credentials, reporting concerns, and participating in training. A case study on protecting patient confidentiality highlights the importance of governance, monitoring, and continuous education. Privacy risks originate from multiple sources, with human error and unauthorized access being the most significant. Effective privacy programs rely on governance, technology, education, and monitoring to achieve stronger protection and compliance. Chapter Summary: Privacy, confidentiality, and patient rights are essential for effective healthcare information management. Welcome to Chapter 5 of our Healthcare Information Management series, focusing on digital health records security and protection. In this chapter, we'll explore the essentials of protecting digital health records, covering everything from foundational principles to advanced strategies. Understanding information security in healthcare is crucial for protecting patient data, reducing cyber risks, and ensuring compliance. The CIA triad is fundamental to healthcare security, focusing on confidentiality, integrity, and availability. Health record security is vital for patient privacy, clinical decision-making, regulatory compliance, and organizational resilience. Digital health records face threats like ransomware, malware, unauthorized access, and data breaches. Cybersecurity fundamentals include risk assessment, access management, monitoring, and incident response. Access controls are crucial for ensuring only authorized individuals access health information. Role-based access control, RBAC, ensures access permissions align with job responsibilities, supporting the principle of least privilege. Authentication verifies user identity before granting access, using methods like passwords, biometrics, and security tokens. Multi-factor authentication, MFA, enhances security by requiring multiple forms of identity verification. Encryption protects information by converting it into an unreadable format, accessible only with the correct decryption key. Data protection involves securing information both at rest and in transit, using methods like encrypted storage and secure network transfers. Security monitoring and logging help identify suspicious activities and potential incidents before they escalate. Risk management involves evaluating and prioritizing security risks to support informed decision-making. Security governance establishes responsibility for protecting healthcare information at all organizational levels. Workforce security awareness is crucial for reducing human-related risks in protecting health information. A case study demonstrates the importance of layered security controls and workforce engagement in strengthening health record security. Understanding risk sources helps prioritize protection efforts and allocate resources effectively. Effective health records protection requires multiple layers of security working together. In summary, protecting digital health records requires strong governance, access controls, encryption, monitoring, and workforce awareness. Welcome to Chapter 6, where we delve into the critical aspects of documentation standards and clinical record integrity, essential for healthcare compliance and information management. In this chapter overview, we emphasize the importance of accurate documentation for patient care and compliance. We'll explore standards, accuracy, auditing practices, and governance. Understanding clinical documentation is vital as it serves multiple roles, from communication to compliance. High-quality documentation supports excellence in every dimension of care. Documentation standards are crucial for maintaining consistency and reliability in healthcare information. They protect patient safety and improve care coordination. High-quality documentation is characterized by accuracy, completeness, timeliness, and more. These traits ensure effective clinical outcomes and compliance readiness. Accuracy in clinical records is paramount for patient safety and organizational performance. It requires correct identification, proper data entry, and regular verification. Completeness in health records ensures all necessary information is available for patient care. Incomplete records can lead to clinical and compliance risks. Timeliness in documentation is essential for accurate and reliable healthcare information. Delays can introduce risks and affect decision-making. Consistency and standardization in healthcare records reduce variability and improve quality. Policies, templates, and training programs are key components. Documentation integrity is about maintaining the reliability and trustworthiness of healthcare records. It's essential for patient safety and compliance. Clinical record integrity programs ensure documentation remains accurate and compliant. Structured oversight improves performance across the organization. Documentation policies and procedures establish expectations for record management. They ensure consistency and accountability across healthcare organizations. Authentication and record validation confirm the origin and accuracy of healthcare documentation. Strong practices are essential for clinical record integrity. Identifying and addressing documentation errors proactively is crucial. Understanding risk categories enables targeted prevention and correction strategies. Auditing clinical documentation helps evaluate record quality and compliance. Audits support continuous improvement and commitment to documentation excellence. Clinical documentation improvement programs enhance documentation quality and accuracy. They strengthen the foundation of healthcare information. Technology can improve documentation quality when implemented thoughtfully. However, human judgment and expertise remain irreplaceable. A mini-case study on improving clinical documentation integrity highlights the importance of comprehensive training and structured processes. Documentation deficiencies often result from process and training challenges. Addressing root causes through training and workflow design is more effective than reactive solutions. Critical factors supporting documentation integrity include training, standards, audits, and oversight. Continuous improvement strengthens integrity across the organization. In summary, documentation standards and clinical record integrity are essential for healthcare information management. They support patient care, compliance, and quality improvement. Welcome to Chapter 7, where we delve into the essentials of health records lifecycle management, a crucial aspect of healthcare information governance. Health records must be managed from creation to final disposition. This chapter will guide you through the entire lifecycle, focusing on record creation, storage, and retention. Understanding the lifecycle stages is key to managing healthcare information effectively. Each stage requires specific controls to ensure security and compliance. Lifecycle management is vital for protecting patient information, improving accessibility, and meeting compliance obligations. It reduces risks and optimizes resources. Accurate information capture is the foundation of the lifecycle. It begins with clinical documentation and extends to treatment plans. Data collection standards ensure records are accurate, complete, and consistent. These standards are crucial for maintaining data integrity throughout the lifecycle. Secure storage of health records is fundamental. It supports operational needs and compliance obligations, ensuring information is protected and accessible. Electronic record storage systems must support security, integrity, and availability. They include EHR systems, cloud environments, and more. Access and use of information must be controlled to protect patient privacy and ensure information integrity. Governance controls are essential. Regular maintenance and updates ensure health records remain accurate and reliable. This includes documentation updates, corrections, and quality reviews. Retention requirements ensure records are kept for the necessary period based on legal and organizational needs. This supports compliance and accountability. Retention schedules define how long records should be maintained. They consider regulatory requirements, operational needs, and historical value. Archival management secures inactive records for long-term preservation. ensuring they remain accessible and protected from degradation. Long-term preservation ensures digital records remain accessible, readable, and accurate over time, safeguarding organizational memory. Secure disposal of records is crucial once retention requirements are met. Proper disposal prevents privacy and compliance risks. Implementing secure disposal best practices ensures information cannot be reconstructed, protecting privacy and demonstrating compliance. Lifecycle governance ensures consistent management of healthcare information, strengthening accountability and supporting continuous improvement. A case study on modernizing records retention shows how structured governance can transform records management, improving efficiency and compliance. Understanding the distribution of lifecycle activities helps organizations allocate resources effectively, focusing on storage, access, and information creation. Critical success factors for lifecycle management include governance, retention policies, and security controls, ensuring effective information management. In summary, effective lifecycle management ensures healthcare information is managed securely and efficiently, supporting compliance and operational needs. Welcome to Chapter 8, where we explore the vital role of health information exchange and interoperability in modern healthcare systems. In this chapter, we'll cover the fundamentals of health information exchange, delve into interoperability challenges, and discuss compliance and governance for seamless healthcare delivery. Health information exchange facilitates the electronic movement of healthcare information, enhancing care coordination, clinical decision-making, and population health. Information exchange is crucial for maintaining care quality and patient safety, ensuring timely access to information across the patient journey. Interoperability enables different systems to exchange and interpret information effectively, driving digital healthcare transformation. Interoperability is structured into levels, each enhancing the effectiveness of information exchange across healthcare organizations. Foundational interoperability allows basic electronic information exchange, establishing the infrastructure for higher levels of interoperability. Structural interoperability ensures consistent data interpretation across systems through standardized formats and structures. Semantic interoperability allows systems to exchange information with preserved meaning, ensuring accurate data interpretation. Organizational interoperability focuses on governance and collaboration, recognizing that technology alone is insufficient for effective exchange. Healthcare organizations rely on established standards to facilitate consistent interoperability across systems and organizations. FHIR is a modern framework transforming healthcare interoperability, making it faster, more flexible, and accessible. Interoperability enhances patient care by enabling providers to access complete information precisely when needed. Information exchange programs must address compliance requirements to protect patients and organizations. Security challenges in information exchange require active management to protect sensitive data and maintain trust. Organizations face barriers to interoperability, requiring strategic planning and collaboration to overcome them. Governance provides essential oversight and strategic direction for information exchange, ensuring alignment with organizational goals. A case study demonstrates how improved information exchange enhances care coordination and reduces inefficiencies. Effective information exchange programs lead to significant improvements in care coordination, information access, and patient safety. Interoperability success requires addressing technical, operational, and governance challenges simultaneously. Health information exchange and interoperability transform healthcare by connecting isolated records into a cohesive system, enhancing care delivery. Welcome to Chapter 9, where we delve into compliance auditing and monitoring programs, essential for healthcare information governance. Compliance auditing and monitoring programs are vital for evaluating adherence to policies and improving governance. Understanding compliance monitoring involves identifying gaps, detecting risks, and improving accountability. Compliance auditing provides a structured method for evaluating performance and supporting improvement. Monitoring and auditing serve different purposes but together form a comprehensive oversight strategy. Clear objectives in compliance audits ensure meaningful and actionable results for organizations. Different types of audits address specific organizational needs and risk areas in healthcare. Internal audits are crucial for embedding compliance oversight directly into operations. Documentation reviews and record audits support healthcare quality and regulatory readiness. Privacy compliance audits evaluate how healthcare information is accessed, used, and disclosed. Security assessments evaluate the effectiveness of safeguards protecting healthcare information. Successful audits require careful planning and preparation to ensure efficient execution and meaningful results. Auditors collect evidence to evaluate compliance performance, ensuring reliable and defensible findings. Identifying compliance gaps is crucial for addressing deficiencies and improving performance. Corrective action programs address identified compliance deficiencies and drive improvements. Performance metrics are essential for evaluating compliance effectiveness and supporting decision-making. Continuous improvement through monitoring strengthens compliance performance and resilience. A case study highlights the importance of proactive auditing and continuous monitoring for compliance improvement. Understanding common sources of compliance findings helps prioritize corrective actions effectively. Critical success factors for compliance monitoring programs include leadership support and regular audits. Compliance auditing and monitoring programs provide essential oversight for healthcare information management. Welcome to Chapter 10 of the Healthcare Information Governance series, focusing on incident management, breach response, and investigations. In this chapter, learners will explore the full spectrum of incident management, from detection to resolution and beyond. Key areas include incident management principles, breach response procedures, investigation methodologies, and corrective actions. Understanding healthcare information incidents is crucial. These incidents can compromise the confidentiality, integrity, or availability of information. Prompt response helps minimize organizational impact. Effective incident management is not just a regulatory requirement. It's a cornerstone of organizational resilience and patient trust. It helps protect patient information, reduce operational disruption, limit legal exposure, preserve trust, and improve resilience. Healthcare information incidents can take many forms, including privacy violations, unauthorized disclosures, cybersecurity incidents, lost or stolen devices, documentation errors, and improper access to records. A privacy breach occurs when protected information is accessed, used, disclosed, or exposed in an unauthorized manner. Immediate response priorities include containing the breach, assessing the scope, and notifying stakeholders. Information security incidents involve threats to information systems or healthcare data. These events often require both technical and compliance responses working in coordination. Organizations should identify incidents as quickly as possible. Early detection helps reduce incident impact and limits the scope of potential harm to patients and the organization. Organizations should establish clear reporting procedures so that employees understand how and when to report incidents. Timely reporting is essential to effective response. Not all incidents carry the same level of risk. Classification helps organizations prioritize response efforts and allocate resources appropriately. Incident response plans provide structured guidance for managing events. Preparation improves response effectiveness and reduces the time required to contain and resolve incidents. Investigations help organizations understand what happened, how it occurred, and what must be done to prevent recurrence. Investigations should be objective, thorough, and well documented. Organizations should preserve evidence that may assist investigations. Proper evidence management supports accurate findings and protects the organization in the event of regulatory review or legal proceedings. Root cause analysis identifies the underlying factors that contribute to an incident. Understanding root causes supports long-term improvement rather than simply addressing surface-level symptoms. Corrective actions address identified issues and reduce the likelihood of recurrence. Preventive measures strengthen organizational resilience against future incidents. Certain incidents may require formal notifications or reporting to regulators, patients, or other stakeholders. Reporting obligations should be clearly understood and built into response plans. After an incident is resolved, organizations should evaluate response effectiveness. Continuous learning improves future readiness and strengthens the overall incident management program. A healthcare organization discovered that an employee had accessed patient records without a legitimate business purpose, a classic example of curiosity-driven unauthorized access. Healthcare incidents can arise from both technical and human factors. Human error and unauthorized access frequently represent the largest contributors to information-related incidents. Organizations that invest in preparedness, workforce awareness, governance, and response capabilities are better positioned to manage incidents effectively and achieve strong compliance outcomes. Incident management, breach response, and investigations are critical components of healthcare information governance. Effective programs encompass the full lifecycle from detection through continuous improvement. Welcome to Chapter 11, where we delve into the regulatory requirements and healthcare compliance frameworks essential for effective governance in healthcare. In this chapter overview, we will explore healthcare regulations, governance frameworks, and audits and best practices that guide the management of health information. Understanding healthcare compliance is crucial. It involves adhering to laws and ethical obligations, helping organizations protect patient information, reduce risks, and improve accountability. Regulatory compliance is vital for patient safety, privacy protection, and maintaining organizational integrity. It ensures healthcare delivery is safe and accountable. The healthcare regulatory environment encompasses various domains like privacy protection and information security, each with specific compliance obligations. Privacy regulations are crucial for managing health information responsibly, ensuring patient rights and safeguarding against unauthorized access. Healthcare information security requirements focus on protecting data from unauthorized access, ensuring robust security measures are in place. Health information governance aligns operational practices with compliance, supporting sustainable accountability through policy development and risk oversight. Regulatory expectations for documentation emphasize accuracy, completeness, and accessibility to support patient care and compliance. Records retention and legal requirements ensure accountability and compliance throughout the information lifecycle, emphasizing secure storage and proper disposal. Consent and authorization requirements ensure patient information is managed appropriately, supporting transparency and patient rights. Compliance frameworks provide structured approaches for managing regulatory obligations, ensuring accountability at every level of the organization. Accreditation and healthcare standards drive quality improvement and enhance organizational credibility, supporting long-term compliance excellence. Compliance audits and assessments evaluate performance, identify gaps, and demonstrate accountability to regulators and stakeholders. Regulatory inspections and reviews require organizations to maintain documentation and demonstrate compliance activities, supporting audit readiness. Risk-based compliance management focuses on areas with the greatest impact on patient safety and organizational integrity, prioritizing where attention is needed most. Building a culture of compliance involves leadership commitment, accountability, and transparency, ensuring ethical behavior across the organization. A case study on strengthening healthcare compliance governance highlights the importance of consistent practices and effective monitoring for sustainable improvement. Major areas of healthcare compliance focus include privacy protection, information security, and documentation compliance, each critical for organizational success. Critical success factors for compliance programs include leadership commitment and workforce education, driving organizational resilience and accountability. In summary, healthcare compliance programs help manage legal, regulatory, and ethical obligations, ensuring effective health information management. Welcome to Chapter 12, where we delve into the world of digital health technologies and records compliance. This chapter is part of the CDG Training series on health information management. In this chapter, we'll explore telehealth records, mobile health apps, cloud-based records, and AI documentation. Each area plays a crucial role in modern healthcare delivery and compliance. Digital health technologies are transforming healthcare delivery. From telehealth platforms to wearable devices, these tools enhance communication, monitoring, and patient engagement. Digital transformation in healthcare improves access, efficiency, patient engagement, and operational flexibility. It introduces new compliance considerations that must be proactively managed. Telehealth fundamentals include virtual consultations, follow-up appointments, remote monitoring, patient education, and care coordination. These elements expand access and continuity of care. Accurate telehealth documentation is essential for billing, compliance, and continuity of care. It includes patient identification, clinical assessments, treatment recommendations, follow-up plans, and communication records. Privacy and compliance are critical in telehealth. Secure communications, patient consent, authentication, information protection, and access controls are essential safeguards. Mobile health applications enhance patient engagement and extend care beyond traditional settings. They support appointment management, medication reminders, health tracking, and patient education. Mobile health compliance challenges include privacy protection, information security, data storage, user authentication, and third-party integrations. A structured risk assessment is essential before deployment. Cloud-based health record systems offer flexibility, accessibility, scalability, disaster recovery, and operational efficiency. They are essential for modern health information management. Compliance considerations for cloud healthcare systems include data protection, vendor management, access controls, risk assessments, and security monitoring. These ensure responsible information management. Patient portals and digital engagement platforms enhance transparency and engagement. They support appointment scheduling, secure messaging, record access, test result review, and prescription management. Wearable technologies and remote monitoring generate valuable health data. Fitness trackers, cardiac monitors, glucose monitoring, and remote diagnostics support patient care and decision-making. Artificial intelligence supports health information management through documentation assistance, clinical coding support, information analysis, workflow automation, and predictive analytics. AI-assisted documentation improves efficiency but requires careful management of accuracy, documentation quality, human oversight, data protection, and accountability structures. Emerging compliance risks in digital healthcare include expanded attack surfaces, privacy concerns, third-party dependencies, data governance challenges, and regulatory uncertainty. Proactive management is crucial. Governance for digital health technologies involves policy development, workforce education, risk management, vendor oversight, and compliance monitoring. It supports responsible technology adoption. A mini case study on implementing a digital health platform highlights the importance of privacy assessments, governance controls, security measures, and documentation standards for successful integration. Digital health technologies in use include telehealth platforms, mobile health apps, cloud-based records, and emerging technologies. They're transforming healthcare delivery and management. Critical success factors for digital health compliance include governance programs, privacy protection controls, security management, workforce training, vendor oversight, and continuous monitoring. In summary, digital health technologies enhance healthcare delivery, patient engagement, and operational efficiency. They require a balance of innovation with governance, privacy, security, compliance oversight, and continuous monitoring. Welcome to Chapter 13, focusing on workforce training, awareness, and compliance culture in healthcare information management. People are essential in safeguarding healthcare information. This chapter covers training programs, employee responsibilities, awareness initiatives, and culture development. Compliance culture shapes how employees approach their responsibilities. Key elements include accountability, ethical conduct, information stewardship, policy adherence, and continuous improvement. Training empowers employees with the skills needed for compliance. It supports regulatory compliance, information protection, risk reduction, better decision-making, and accountability. Human behavior is crucial in compliance. Employees must access, share, and document patient records responsibly, manage records, and follow organizational policies. Compliance is everyone's responsibility. Employees must follow policies, protect patient privacy, maintain documentation quality, report concerns, and complete training. Effective training programs cover privacy requirements, security awareness, documentation standards, records management, incident reporting, and ethical conduct. New employee orientation should include organizational policies, privacy expectations, security requirements, documentation practices, and reporting procedures. Continuous training strengthens compliance. It includes annual refresher training, policy updates, specialized workshops, awareness campaigns, and simulation exercises. Privacy awareness programs help employees protect sensitive information, supporting patient trust and regulatory compliance. Security awareness programs reduce organizational risk by transforming employees into a line of defense against threats. Ethical conduct and accountability are essential for compliance. Employees should act with integrity, responsibility, transparency, respect for patient information, and compliance with expectations. Behavioral compliance focuses on positive actions rather than rules. It involves awareness, personal responsibility, positive reinforcement, and organizational engagement. Leadership plays a crucial role in compliance culture by demonstrating commitment, supporting training, reinforcing accountability, providing resources, and encouraging ethics. Regular communication helps maintain compliance awareness. Methods include newsletters, team meetings, educational materials, awareness campaigns, and compliance updates. Encouraging incident reporting is vital for compliance success. It involves faster issue identification, reduced risk, improved accountability, and a stronger compliance culture. Organizations should evaluate training effectiveness to ensure compliance investments deliver real results. Methods include knowledge assessments, completion rates, audit results, incident trends, and employee feedback. A case study shows that building a strong compliance culture requires role-based training, leadership engagement, awareness campaigns, and continuous improvement. Understanding compliance challenges is crucial. Key issues include lack of awareness, human error, insufficient policy understanding, communication gaps, and accountability issues. Critical success factors for compliance culture include leadership commitment, workforce training, accountability systems, communication programs, employee engagement, and continuous improvement. In summary, workforce training, awareness programs, accountability systems, and compliance culture development are essential for successful healthcare information management programs. Explore the emerging trends and future challenges in health information management, focusing on advanced technologies and strategies for the digital future. Healthcare information management is rapidly evolving with new technologies, digital health services, and innovative management strategies. This chapter will explore artificial intelligence, advanced analytics, blockchain, interoperability, and future compliance. Health information management is shifting from traditional roles to strategic governance and data-driven decision-making. Key areas include digital transformation, information governance, advanced analytics, and population health. Artificial intelligence is enhancing healthcare information management by improving efficiency and introducing new governance considerations. Key areas include clinical documentation support, coding assistance, data classification, and workflow automation. Establishing governance controls for AI-enabled solutions is crucial for ensuring responsible and trustworthy use of technology in healthcare. Key considerations include transparency, accountability, human oversight, data quality, privacy protection, and risk management. Technologies can assist clinicians by generating documentation drafts and supporting workflows, reducing the burden on healthcare professionals. Benefits include reduced documentation burden, improved efficiency, and enhanced consistency. Advanced analytics enable healthcare organizations to extract valuable insights, supporting strategic decision-making. Key areas include quality improvement, resource planning, population health management, and performance monitoring. Predictive analytics uses historical data and statistical models to identify patterns and support future planning in healthcare. Key areas include readmission risk, resource forecasting, care management, and operational planning. Healthcare organizations generate massive volumes of information, creating both opportunities and governance challenges. Key areas include electronic health records, wearable technologies, remote monitoring, and genomic information. Blockchain technology offers secure and transparent methods for healthcare data management. Key areas include information exchange, identity management, supply chain tracking, and data integrity verification. Blockchain governance requires careful consideration of privacy, access controls, regulatory compliance, and integration challenges. Effective governance ensures secure and compliant use of blockchain in healthcare. Interoperability initiatives continue to expand globally, driven by regulatory mandates and patient expectations. Key areas include improved care coordination, enhanced accessibility, greater patient engagement, and cross-organizational collaboration. Patients increasingly expect convenient, on-demand access to their healthcare information. Key areas include patient portals, mobile applications, personal health records, and secure messaging. The Internet of Medical Things, IoT, includes connected devices that generate and exchange information, creating vast data sources. Key areas include wearable devices, remote monitoring equipment, connected diagnostic tools, and smart medical technologies. Emerging privacy and compliance challenges arise from expanding data collection, third-party partnerships, cross-border information sharing, and evolving regulatory requirements. Organizations must address these risks proactively. Healthcare information remains a prime target for cyber threats. Key risks include ransomware attacks, credential theft, data breaches, and AI-assisted threats. Proactive security strategies are essential. Organizations should prepare for future challenges through governance enhancements, workforce development, technology evaluations, risk management programs, and continuous improvement. A healthcare network successfully implemented an enterprise governance program, enhancing data stewardship, privacy, and compliance. This initiative improved compliance readiness and information quality. Emerging technologies like AI, analytics, and interoperability are expected to have the greatest influence on health information management. Organizations must prepare governance frameworks to adapt to rapid innovation cycles. Future HIM success depends on strong governance, workforce competency, privacy management, cybersecurity capabilities, and adaptability. Organizations must prepare today to better address tomorrow's challenges. Health information management is evolving alongside advances in technology, data, and governance. Organizations that proactively strengthen governance, compliance, and workforce capabilities will be well-positioned to manage emerging challenges and seize future opportunities. Welcome to Chapter 15, where we explore building a sustainable health information compliance program and the pathway to professional certification. Long-term success in health information management hinges on sustainable compliance programs. These programs are built on governance, leadership, workforce engagement, and continuous improvement. A sustainable compliance program ensures healthcare operations adapt to changes while maintaining success. Key elements include leadership support, effective governance, skilled personnel, continuous monitoring, and ongoing improvement. Successful compliance programs are built on foundational elements like governance structures, information stewardship, risk management, workforce competency, accountability systems, and continuous improvement. Leadership plays a crucial role in maintaining effective compliance programs. Strategic direction, resource allocation, policy approval, compliance oversight, and culture development are key components. Governance provides accountability and structure for compliance activities. Core functions include policy management, compliance monitoring, and risk oversight, supported by strategic governance activities. Building a culture of accountability involves ethical behavior, transparency, accountability, information stewardship, and continuous learning. These elements drive organizational performance daily. Workforce development is essential for maintaining compliance capabilities. It includes continuing education, professional certifications, workshops, role-based training, and leadership development. Strategic planning aligns compliance activities with operational goals, promoting sustainability and readiness. It involves risk reduction, regulatory readiness, technology adoption, and workforce development. Risk management helps organizations address compliance-related risks, improving decision-making and resilience. Key areas include privacy concerns, security incidents, documentation deficiencies, regulatory changes, and technology challenges. Continuous monitoring and oversight are crucial for sustainable compliance. Key activities include audits, compliance reviews, risk assessments, policy evaluations, and performance reporting. Measuring compliance performance involves audits, training, quality documentation, trends, and actions. These metrics guide improvement efforts and demonstrate program value. Technology enhances compliance activities by supporting efficiency and accountability. Key tools include monitoring tools, audit management, policy repositories, training platforms, and reporting solutions. Healthcare organizations must remain adaptable to changes. Future readiness involves supporting innovation, monitoring regulatory developments, evaluating technologies, developing workforce capabilities, and strengthening governance. Resilient organizations maintain compliance despite disruptions. Key areas include incident response planning, business continuity programs, workforce preparedness, governance oversight, and continuous improvement. Professional growth in health information management opens doors to rewarding careers. Key areas include compliance management, privacy leadership, information governance, records management, and healthcare consulting. A case study on transforming a compliance program highlights the importance of governance restructuring, workforce development, enhanced auditing, risk management, and performance monitoring. Sustainable compliance programs rely on interconnected pillars like governance, workforce competency, compliance monitoring, risk management, information governance, and continuous improvement. Organizations achieve compliance excellence through leadership commitment, workforce training, governance oversight, compliance monitoring, risk management, and continuous improvement. Throughout this course, learners have explored a comprehensive framework for managing healthcare information responsibly. CDG Training equips professionals with practical knowledge for excellence in compliance and patient trust. To complete a professional certification in Digital Health Records Compliance, visit CDG Training. The program offers comprehensive learning and certification for healthcare professionals. Thank you for choosing CDG Training, your partner in health information management excellence. We wish you success in your professional journey.